Countries with greater progress toward universal health coverage, UHC, had smaller declines in childhood vaccination coverage during the COVID-19 pandemic, according to a new study publishing August 16 in open access journal PLOS Medicine by Yesim Tozan of New York University's School of Global Public. Many previous studies have indicated that UHC strategies improve health service coverage, utilization and outcomes, and result in improvements in population health. In the new study, researchers used the COVID-19 pandemic as a natural experiment to compare differences in childhood immunization coverage based on countries' progress toward UHC. Immunization data were derived from the WHO-UNICEF Joint Estimates of National Immunization Coverage dataset, which includes information on 195 countries and 14 childhood vaccines between 1997 and 2020. The researchers found that countries with a high UHC index were associated with a 2.7% smaller decline in childhood immunization coverage during 2020 compared to countries with a lower UHC index, after adjusting for potential confounders, 95% C0. 75 to 4. 65, p equals 0.007. During the pandemic year of 2020, countries with a high UHC index had a coverage rate of 91.9%, while those with a lower UHC index had a coverage rate of 81.7%. This study also sets the stage for future research in understanding the synergistic impact of investments in global health security and universal health coverage strategies on countries' health system resilience. The COVID-19 pandemic has affected the delivery of essential health services across. This study provided the much-needed quantitative evidence of the protective effects of universal health coverage in times of public health crises, underpinning the policy recommendations for sustained political commitment and investments for universal health coverage to build resilient health systems. Note: content may be edited for style and length. Journal reference: Suying Kim, Tyler Y. Headley, Yesim Tozan. Universal healthcare coverage and health service delivery before and during the COVID-19 pandemic. A difference in different study of childhood immunization coverage from 195 countries. Study analyzed how childhood immunization coverage differed during the COVID-19 pandemic between countries with varying universal health coverage. Science Daily. Study analyzed how childhood immunization coverage differed during the COVID-19 pandemic between countries with varying universal health coverage. Science Daily. Retrieved August 16, 2022 from ift.tt/2uahai4plos. Is universal healthcare progress related to changes in childhood vaccination rates? Study analyzed how childhood immunization coverage differed during the COVID-19 pandemic between countries with varying universal health coverage. Science Daily. https://ift. TT, 2UAHYJ4, accessed August 16, 2022. Thanks for watching. Please subscribe my channel for more videos.